Welcome everyone. I'm going to moderate the event today and I just wanted to welcome you, and we're going to wait a couple of minutes, make sure that everyone gathers, and then we will get going. And thank you. I see that we have some questions up actually already, so I will be making sure to address the questions. So let's just take a couple of minutes and let everyone gather up. Thank you. Good evening, everyone. I'm Dalma Martinovic-Weigelt, and I will be moderating today's panel. And I am just going to open with a brief presentation to highlight first who our panelists are, and then second to highlight some of the great things about St. Thomas that we think are particularly attractive to students who are intended to pursue health science careers. So today's panelists are going to be Michael Getty, who is a pre-health advisor. Dr. Roxanne Pritchard unfortunately could not be here tonight, but I and Martha Mulgeda, who is a neuroscience alumna, will make sure to address any neuroscience questions that you might have. Dr. Paul Melick will be here from Health and Exercise Science. Dr. Tom Marsh from Chemistry and Biochemistry programs. Dr. Colin Martin from Biology and Biology of Global Health programs. And finally, I already mentioned Martha, but Martha is an alumna, and it's a particular pleasure to introduce you to her because she's here tonight to represent, students' view and answer some of the questions that are probably best addressed by students themselves. So I will need to go to the next slide, and I'm learning how to do this. Know how to do it. Okay. Thomas, could you please advance the slide? All right, I'm just going to tell you what is going on this slide presentation. There we go. Sorry, we're just learning how to do a big webinar. So the first thing I really wanted to point out today, often when people come into the health science programs, they're aware of a subset of programs. But typically what we find out is that our students over time get excited about many additional programs that we have to offer. And I'm here today to tell you that actually students pursue health sciences through a variety of different paths, and some start right away in a certain program that's very sciencey, very specific, biology, biochemistry, chemistry, things like that. But we also have students who kind of build their own path, and here at University of St. Thomas, they actually can pursue individualized majors. In other words, we can help you build a major and individualize it a little bit to your needs and the past experiences as well as future goals. And also I want to point out that it is not unusual to have students who actually minor in sciences and major in areas such as English or music, who also pursue health careers from those directions. So one of the things that is, I think, great about the university is that we have a variety of programs and that you can actually realize your path through any one of these programs. Next slide, please. So one of the highlights that I think is incredibly important, and especially in today's world, is that our students regularly have opportunities to interact with the professionals in the field. And not only do they do that through the traditional internships and experiential learning for which they can get credit, but we also make sure to bring professionals into our classrooms. And it is not just visits, brief visits and things like that, but we also incorporate activities that are deeply engaged with the community into our classroom, such as students might be conducting a problem-solving exercise or research for a community, and we have a multitude of programs through which students can engage in those kinds of activities. So here, what I'm showing you here is an example of toxicology course that I teach, and we have panelists from all over the state here. And what we're doing here is we're discussing one of the outputs of the class, where students have looked at the health issues in West St. Paul in terms of air quality and whatnot, and we're kind of discussing and presenting to the experts, and we will later on would have had it and presented to the community as well. Next slide. So another feature of our classrooms is that we really try to integrate community in our thoughts and in our ways of thinking. And here we have Dr. Jill Mainsky highlighted, who, for example, taught a course about HIV/AIDS. And Dr. Martin can talk more about that course because he himself teaches it. And in this particular case, students got engaged with the Open Arms of Minnesota in order to really understand what the patient's experience might be, or in order to learn how to empathize and how to contribute to the community. In addition to that, many of our classes are actually taking place all over the globe, and we have substantive offering of the study abroad courses. And often we see a question from science students, can I do these courses? Because science students think that they have much less flexibility, and the answer is yes. We have science courses taught by UST faculty abroad, but we also have partner organizations with which we execute some of these courses. So you have lots of options, actually. Next slide, please. Another thing, and probably the thing that we are most proud of, are the experiences that students actually create for themselves. And this is Biology Global Health student, Fatumada Jaite, who actually, together with her advisor, co-imagined and co-coordinated a course that she conducted abroad. And as a result of this course, she actually started a nonprofit, and she currently operates a nonprofit that is focused on global health and is in particular enhancing the maternal care in Gambia. So I don't know if you're aware of this, but University of St. Thomas is an Ashoka university, And as such, we have a commitment to change making, and especially obviously change making that creates good for the community. And we often incorporate those kinds of aspects in our courses as well. Next slide, please. In addition to classroom, we also conduct quite a bit of research with our students, and that is something that we really take a pride in. And here I'm just highlighting that sometimes what we see students conducting a variety of research. You know, you may not be intending to be a chemist, but chemistry, for example, has a very extensive research program, and many of our pre-health students actually participate in the program. And it's really exciting because you get to learn how to think about science, you gain the skills in the science that you will need in your future employment, but also a series of transferable skills such as critical thinking and so on. And many of our students actually end with products that are actually quite unusual for undergraduate students, such as publications. And here I'm just highlighting two of our students who are working on environmental health issues. They're looking at the impacts of the oil spills, aged oil spills on our groundwater and on human health. And they're actually co-authors on the paper we recently published. So there's some really, really unique opportunities to gain research experience and go in depth on some of those things. Next slide, please. Another thing, and you can ask Dr. Martin much more about this because he's currently coordinating this. We also have several programs, and one that I really want to highlight is that allows students who are in these pre-health professions to learn about other aspects of health ecosystem, so to speak. And in this particular case, our students have opportunities to conduct research in a health industry setting where they work very closely with the Mayo Innovation Office, and they actually work together with our business students and with the Mayo collaborators to evaluate patents and innovations and so on, and they kind of get to immerse themselves in the business side of the things while at the same time using their science skills in order to improve the business decisions. Next slide, please. And one of the things that you probably have heard about already that we have developed at university is a program that's called Living Learning Communities. And the idea here is that we put together students in these living learning communities, which means that they live in proximity of each other and they're also co-enrolled in the same courses. And what this does is it not only does it structure these social communities, but it allows students to actually kind of socialize with individuals right away who have very similar academic interests. And we find that this often can be very motivating, and students report back that this is a good experience for them. Next slide. Another thing I wanted to highlight today is that we have really good academic advising, and not only do we provide personalized academic advising to students, you know, when you start here, you're going to be assigned a personal advisor, and we will meet with you personally every semester and discuss your plans. But in addition to that, we also have health professions advising, and tonight Michael Geddy is here to represent health professions advising. And in addition to the resources of individual advisors, you have Michael Geddy, whose main job is to support pre-health students. Next slide, please. And this is my final slide. I really wanted to emphasize that many of the health careers and schools, graduate schools, put great emphasis on service, and we provide many opportunities for our students to serve the community. And this is just a little snapshot from the State Fair event that we participated in last year. Students had a great time, engaged with many, many people, and really kind of highlighted some of the research and community stories for the public. So with that, I'm going to close this brief presentation, and I hope that kind of got you to ask some questions about it or some totally unrelated questions. Before I start addressing the questions, I just want to let you know that We will make sure to record all of the questions, and if we cannot get to all of the questions today, we will make sure that those questions are answered by us and by the admissions office. So you will be receiving emails with the responses to the questions that you posted. So right now what I'm going to do is I'm just going to select few questions and then turn it over to the panelists. So one of the first questions is, are healthcare LLC participants required to take a biology placement test of some sort? And what happens if you do not meet or pass the requirements? Colin, could you address that?
Yeah, thanks, Dalma. So I think the reason for this question was because of the wording on one of the slides that was just presented, specifically the slide about the Health Professions LLC. There is no biology placement exam, and I think that turn of phrase is a little confusing. I think a better way to think about it is that you're required to take that first biology course during your first semester to live in the LLC, but there's no sort of test or requirement to pass before you can register for that class. So it's just I would like to take that course along with all the other residents.
Thank you, Colin. Another question we have is, do you and how do you get a pre-health professions advisor? And I'm going to call on Michael Getty to answer this question.
Hi. The pre-health professions advising program is basically on call for anybody at any stage of the process of discerning or preparing for an application to a health professions program after they graduate. And one of the advantages of being at a small institution like St. Thomas is that the pre-health advising system goes wherever you go. So we stay with people whenever they apply to the health professions program of their choice, whether that's during junior year, during senior year, or after graduation.
That's great. Thank you, Michael. Another question we have is, can you major in exercise science to become a PA? And Paul Melick, could you answer this question?
Happy to, thanks, Dama. The short answer is yes. While most exercise science students are usually pre-physical therapy or pre-occupational therapy, we have, I would say, 1 to 3 students a year go into PA. It's just a matter of supplementing with, usually it's biochem, and then occasionally, depending on what other prereqs are needed for certain PA schools, 1 or 2 other chemistry courses as well.
I think there's a question about how technology savvy are the professors. And I'm going to take this one on. My husband would tell you not savvy at all, because I kind of refuse to deal with technology at home. But actually, we are quite savvy with the technology, and I would say particularly so in sciences. And honestly, the reason I try to not do technology stuff at home is because in my typical day, I deal a lot with technology. Several of us have taught many courses online, for example, for many years, and our labs are typically equipped with really high level of technology that requires a lot of experience, a variety of software and things like that. So we're pretty well versed in technology, and I would say that we are very fortunate here at the university that we actually have a stellar and I'm going to let Colin tell you what Stellar is, because he served as a Stellar Fellow and what it does for the community.
Yeah, one of the things that I think now a lot of people on campus are feeling very grateful for is that for the last 5+ years, St. Thomas has really put a lot of resources and staffing emphasis in a variety of programs to encourage the use of complementary technologies in the classroom. And like Dalma said, I was one of the fellows who did sort of a year-long training in that. And for me, that's been incredibly valuable for now. So I think a lot of the professors that you'll take classes with, particularly in STEM, understand that using technological approaches can be really useful, but that the main goal is always student learning and relevance to the topic of the class. So I think very rarely will you see faculty using technology just for the sake of using it, but trying it out, seeing if it works, and does it complement that overall learning. I also want to just say, if you're responding to the question that I saw, I think also partly implied in the question was, are professors generally supportive of students using iPads or other technology to kind of involved for students to use in the classroom? I think generally, I can only speak for myself. I always tell my students that each one of them is different, and they know themselves best, and whatever kind of approach to learning works well for them, that I support them with that. So I think you might find other people who are different, but generally speaking, faculty are supportive of students using laptops and tablets and so forth in the classroom.
Thank you, Colin. I also have a question about research, and I'm going to direct this one to Tom Marsh. Regarding research opportunities, are there any prerequisites to joining these projects?
Well, I think the only prerequisite that I would say was shared, depending upon where a student's going to start, is just having an interest in engaging in the discovery of new knowledge, a willingness to reach out to faculty and talk to them about the research that they have in their laboratories, whether that's a psychology, exercise science, biology, physics, math, chemistry, and biochemistry. We work with undergraduates as our partners in the lab, and where it might seem kind of intimidating at the beginning, it is a really great learning opportunity because of the type of problem solving that you engage in, and the things that you are able to learn outside the classroom. And as you progress through your undergraduate career, if you start out, with an interest in doing research as a first-year student, I guarantee you'd probably find some faculty in chemistry, biology, exercise science, psychology, neuroscience program that would be interested in talking to you about the type of projects that you'd want to participate in. So I could talk on and on about this, but I would say, to sum up, our faculty are very interested in working with students who are interested in doing research. And there isn't necessarily a prerequisite course that you need to be qualified to do that. So there's a lot of different opportunities and different tiers of research that you can do. But just to get started, no prerequisite.
Thank you, Tom. The next question I'm going to direct to Paul Melick. Is there a certain curriculum for going into pre-chiropractic program?
Thanks, Dama. I would say the short answer is, much like most graduate schools for health sciences, there's a selection of prereqs you have to attain in order to get into those schools. So you theoretically could do that with any major. With that being said, our exercise science curriculum, we actually just revised it and was sort of built off the model of physical therapy, chiropractic, and occupational therapy. So our curriculum fits for those three schools really well. And the only caveat to that is a few chiropractic schools do request a certain chemistry and a certain psychology, but again, that depends on the school.
Thank you. We have a couple questions about pre-vet majors, and mostly regarding what kinds of courses do students take and whether we have a pre-vet track. And Michael, could you answer those questions?
Sure. So for most people with an interest in veterinary medicine, a biology major is going to be a pretty natural fit. But like Professor Martinovich said at the beginning of the presentation, a track to a health professions program is compatible with a lot of different majors. It's really a question of how to sequence the given prerequisites in a field and very common schools that people go to with each student's interests and how they want to sequence things throughout their 8 semesters. But the biology department at St. Thomas is very strong in vertebrate biology, animal ecology, research, behavioral studies, those kinds of things. So the students who go on to veterinary school from St. Thomas tend to be biology majors and very happy biology majors. Did
There
we
is,
get to the question?
yeah, that took care of it. We have a question about, do you have association with University of Minnesota for biomedical research at all? Or do you have your own biomedical research program? And I will let Colin answer this, and I too can comment on this.
So there's no formal relationship with the University of Minnesota, and I think the type of research programs that faculty in, say, the chemistry, biology, neuroscience, psychology programs at St. Thomas have aren't explicitly biomedical in nature, but it is fantastic resource having the University of Minnesota so nearby. And just personally, I've had several students who are advisees or just sought me out as a resource who found summer positions, and some of them transitioned into full-time research positions at the university, which you can just do by applying or finding connections through professional connections that faculty might have, or just applying through the career board on the University of Minnesota website. So the relatively large labs that do more biomedical work at the U are always looking for students with strong technical skills, and that can be while still an undergrad or as a recent grad. And so if you're interested in biomedical research per se, there are ways to get connected with programs at the U, even if we don't have a sort of formal pipeline from St. Thomas.
Yeah, and I will just add to that, that many of us have very active research programs. And for example, my main line of interest is environmental health. And while I don't answer biomedical questions, I use all of the tools that someone in biomedical lab might use. I use genomics, metabolomics. So many of our students actually might start in our labs, gain the tools that are practiced in either different applied sciences or basic sciences. And then, like Colin said, because there are all of these opportunities, obviously in Twin Cities area and regionally, they can use those skills that they have built to actually get into these positions. So lots of different opportunities. And Tom, do you want to add anything about your research program or opportunities for biomedical type of research in chemistry department?
Yeah. So the research we do is basic research, but it is from a chemical perspective, we're working on problems that are associated with biomedical health. So you might have students doing research on the synthesis of new antibiotics, discovery of antibiotic resistance genes, the impact of those things in the environment, which has more of a public health, which is, biomedical. I think if you think about prevention as being a way of relating to biomedical research. And Dr. Martin and Dr. Martinovic could hit the nail on the head. I mean, you're going to get training in the skills that apply to a lot of different problems that people are addressing, including biomedical research. So our students do find positions during their undergraduate career or postgraduate working in research laboratories on things that are more applied towards biomedical research. So.
I have a question from Michael. What should I major in to become a PA?
So physician assistance programs are a relatively recent development in healthcare. I think they've only started coming into their own in the last maybe 5 to 7 years. And so you're going to find people majoring in just about everything from their undergraduate careers going into PA schools. And a lot of people go in as second or even third careers. But as far as like an undergraduate starting point at St. Thomas, given the most common prerequisites in PA programs, a biology major or an exercise science major is going to find the most natural overlap between the courses that they take to graduate and the courses that they take before they apply.
Thank you, Michael. Martha, I have a question specifically for you. It says, Martha, congratulations on graduating in 2018. What are you doing now and how are you applying your major?
Thank you. I am now in a master's program. I'm getting my master's of public health and epidemiology at Columbia. And I think for me, a big thing from my St. Thomas experience that spilled over into this and made me decide to pursue this field is having done a lot of research at St. Thomas. I spent 3 years doing research in the psychology department, and I think trying to understand population health and wanting to pursue a career in public health came from that. And so I have a lot of my research at St. Thomas to thank for this kind of projection. And I finished that up here in May, and then we'll be starting a PhD program in health services research. So, yeah.
Thank you, Martha. Very exciting. I have another question from Michael Getty. Could you talk a little bit about opportunities for students wanting to go into optometry?
Yes, so the set of prerequisite courses for people who want to apply to optometry programs are, they overlap a great deal with people applying to medical school. So chemistry, biology, and also physics, those are common course prerequisites. I think the question speaks to something really important, which is that, you know, in order to apply successfully to a health professions program, you have to succeed academically and take appropriate prerequisite coursework, but you also have to have a really large and extensive and well reflected on experience set. And optometry is no different than any of the other fields. So one of the things that I work on with students as the pre-health advisor is to connect them with volunteer experiences and work experiences that help them build that experience set to become a successful applicant. And volunteering with organizations in the community that sponsor vision awareness and vision care, and also getting involved in research with faculty either at St. Thomas or, like Dr. Martin was saying, at research institutions like U of M. That's also a really important path to preparation.
Thank you. Paul, what should a student major in if they would like to become a nutritionist?
So if your goal is to become a nutritionist, at St. Thomas, we currently don't have a nutrition major. We are in the process of building a nutrition minor. With that being said, if your goal is to be a nutritionist, you can always go into a master's program for nutrition with an exercise science background. If your goal, though, is to become a dietitian, that's a whole different story. And St. Thomas does not have a dietetics program. And as of right now, that's not something on the horizon. So the short answer to my long answer would be, if the goal is to become a nutritionist, I would recommend a master's program. After, the hard push from my end would be either public health or exercise science.
And here's a question that I think we should all try to address because we're all currently in this situation. So how does a student that stays at home participate in group learning? So Colin, I will start with you.
Yeah, thank you. So group learning is a huge part of all of my courses, and obviously that's a big challenge to switch to in an online context. So there are a variety of tools that I use to sort of supplement that online. So it's things like discussion boards and really working hard to make those discussion boards meaningful, not just sort of, yeah, good point comments, but real interaction and engagement between students. And that comes from structuring the assignments thoughtfully and based on the experience that I've had running those types of activities before. I recently had a collaborative activity where my immunology class worked together with the microbiology class, and we had it planned as an in-person activity, and then suddenly we had to do it online. So what we ended up doing was using a collaborative tool called VoiceThread, in which students work together offline or on their own outside of the classroom context, and then put together a sort of virtual presentation about some research related to both immunology and microbiology. So there's lots of different ways. I'm not sure if the question is specifically referring to once the shelter-in-place orders are rescinded and students come back, if there are students who participate from home, but at least as far as the current situation, we really work hard to make sure that those are meaningful interactions rather than just sort of box checking type things.
And Martha, are you currently having any experiences where you're doing group kind of activities?
Yeah, and I think a lot of it is similar to what Colin is saying, in that we're being very active on discussion boards and in trying to engage with one another. And I think that's very important to the whole experience. And I think it's very possible to have a positive experience online. And it's just much about trying to, you know, stay in tune with one another and stay connected with one another. And I think it's, yeah, again, very possible to do this all in the midst of everything and having it all be online.
Tom, what about you? Any comments you have?
Yeah, absolutely. So we do a lot of interactive group work as part of, you know, we have a laboratory course. We're teaching even in an advanced course to facilitate students' interaction where they still have contact with us. We're using the technology that has been going really well. I mean, students have been very positive about that. Setting up breakout rooms where you know, 4 or 5 students can be working together in the class, and then I'll just circulate through the different breakout rooms with the students. And in those breakout rooms, they're all having conversations with each other and they're making progress. And I pop back in after 20 minutes with the next group, and they're like, oh yeah, we've got this, and they've made progress. And I'm like going, oh great. So so those things have been going well. And when people, you know, have struggled, they'd reach out and said, you know, hey, we need some help. And you know, we've done some improvising, but by and large, the technology that we have already has been working really well. So yeah.
Paul, is there anything you would like to add?
I would just echo what Dr. Marsh said, which is that I think one of the things I've realized with this transition to online is we've used a lot of different methods of teaching that I haven't used in the past, and I've gotten feedback from students that it's been helpful for them to experiment with new things and learn in a variety of ways, as opposed to the traditional, what I think are amazing lectures that have been given in person. But to that end, with the conversations I've had with students, having more directed interactions that are sort of foisted upon them through online ways, they've responded really well, and so that's actually a really helpful way to handle things. So.
And I'm just going to say that I do very similar things everyone else talked about, but one thing I want to highlight as I'm sitting here and watching your questions pour in, what we find out is that students that sometimes are not so participative can become very in-person classroom, face-to-face classroom, can actually become more participative once we are in this kind of setting. Because, for example, right now I'm just seeing lots of questions pour in, and typically if this is face-to-face interaction, we don't get that many questions. And some of these tools that promote collaboration in small groups tend to kind of have positive impact on some students as well. Not everyone loves it. I'm not going to pretend everyone loves it, but we do get some students that are typically quiet, kind of coming out and communicating more to each other. Here is a question. Does having a math or computer science major instead of biology major hurt you in admittance to PA school / med school? Michael, could you answer that question?
No.
It doesn't. It's that simple. It doesn't. Actually, I will add to that. I would say that I think lots of medical schools and other professional schools are actually looking to diversify the student body, and they kind of try to build diverse cohorts, and they certainly are looking to students who have unusual backgrounds. And Tom, would you like to add anything?
Yeah, they want good people. They want competent, critical thinkers, people that can do problem solving, and biology, biochemistry, chemistry is not the only discipline where you can develop those skills. You do need biological knowledge, you need some chemistry knowledge. So I'd say if you were going to minor in chemistry and biology and get, you know, computer science, some variation of that, you would have the potential of being a competitive applicant for a medical school program. So.
I've worked with dance majors and Arabic majors and business majors over the years. So your major should be something that you know, you either love or severely like, and if that's computer science, then more power to you.
I like the distinction between like and severely, love and severely like, yeah. So one more question for you, Michael. At what rate are St. Thomas graduates accepted into accredited medical schools?
I've recently run some statistics, and from their first application to, let's say, a second application, which is quite common, the success rate is around 60%, which is actually really good. Nationally, like in other words, over the entire population of the United States, the acceptance rate is very, very low, below 50%, and if you cast the net very widely, the acceptance rate goes below 10%. But as far as students who make use of the resources that are available to them, have, you know, productive and collaborative relationships with faculty, those students enjoy a very high rate of acceptance. And I will say, as somebody who worked at a much larger institution in the past, the advantage that students gain by having small classes in the sciences and having really facilitated access to participation in undergraduate research, those are just enormous assets in the application process. So I'm very proud we do well.
Michael, I have one more related question, and this one is, what's the rate of students getting into the vet school?
I wish I could tell you. The number of people who apply to veterinary medicine programs nationally is quite low, quite small, and the number of people who have applied from St. Thomas into veterinary school is simply not large enough to answer that question meaningfully. I will say that there is, so I manage an online community for people with pre-health interest. It lives on the same platform that people are currently completing their online courses. And there are about 500 St. Thomas students in the community. And I think about 10 to 15 people who are interested in veterinary medicine. So there's kind of a baked-in community.
Paul, I have a question for you. What is the best major to go into if you would like to become a PT?
Exercise science. I would say that our curriculum is built basically around PT. The reason for that is that PT requirements, I would say, fit most of what the mission of exercise science is as a whole. So that's why we structured it that way. With that being said, if you get into exercise science as a PT student, which most students, I would say, start off that way, a lot of students do realize there's other fields in exercise science and then travel on from there. But I would say with a hard yes, it's exercise science.
I have another question, and Tom offered to answer this one. Are the advisors able to help with the graduate program application and help the student have the best chance at admission in the graduate program?
Yeah, I'm going to use the term advisor in a broader term. Typically, students are going to apply to graduate school programs for either a master's program or a PhD in some area of science. Will more than likely have engaged in undergraduate research, and your research mentor is an excellent advisor and someone who would write a very strong, compelling letter of recommendation to graduate programs. Now, your academic advisors will also put you in touch with people and can serve as someone who would mentor you and give you advice on preparing for graduate school. So to that end, we have not just a dedicated academic advising staff, we have faculty that are active researchers that do first-year advising as part of our program, and they participate in the registration and orientation to you know, right when you step in the door, you have that as a resource for you to begin planning and discussing the things that you need to be doing so that you're a competitive applicant when it comes time to submit those for graduate school.
Thank you.
Sure.
And I will take this one. We have a question about the average size of the courses in our majors. And I would say that in most of the biology, chemistry, biochemistry situations, you might start in what we call larger class, maybe about 50, 60 students max. And then by the time you're in your second year, you're going to be in courses that are about 24 students. And then in addition to being in a class, we ensure that you experience very small group environment in the labs actually. So in our introductory courses, the typical lab size is 20, so we can make sure to give you individual attention. And then at the upper level courses, the lab size typically goes down to 12. And then I will ask Paul to comment on what the course sizes are like in his programs.
I would say relatively similar. I think that most of our 200 level classes and 300 level classes, we try to cap at around 24 just to make our labs more functional. Part of the thing with exercise science is that our labs are very dependent on human interaction. So with that, we do cap most things at 24. I would say the average course size as you move up goes down just a little bit, so that our senior research seminars are usually around 12 to 15. So the overall answer to that, I think last I looked, was around 18 is the average number of students in an exercise science course, and that's also true for public health as well.
Here we have a really good question. I think it says, if you major in exercise science for physical therapy and change your mind, what are some other routes you can take besides physical therapy? And I think this is a really important question to ask, because we know that students will change their mind and change their route. So Paul, I'll let you kind of take that one on, and then I can also address some of it.
For sure, and this is a really common question that I get, and I think that I meet with a lot of, I met with pre-COVID a lot of high school students who were interested in being exercise science majors, and I would guess 90 to 99% were thinking pre-physical therapy. The number of students who graduate going into PT school is much, much lower than that. And it's usually because students find new avenues, not because they can't get into a PT school. So those new avenues in our field usually revolve around clinical exercise science, which is any type of rehab science. This includes things like cardiac rehabilitation, pulmonary rehab, anything related to essentially preventative medicine or rehabilitation on the other side of things. The other option is anything related to athletics and performance. So this could include strength and conditioning. And then we've had a lot of students who've gotten into other types of sports performance in more of the private sector as well. The other option, and this is one that always gets a bit of a shrug from people, is personal training, which I understand St. Thomas is not cheap. And when it comes to paying for an education, maybe personal training isn't something that sounds ideal. But with our students, when they leave our program, they leave with a nationally recognized certification, which is only available if you have a 4-year degree in exercise science. What that means then is usually that type of interaction with clients is backed by insurance, or it might mean you can work with a more special population. So for example, when I finished my undergrad before I got into my doctorate program, I was doing this work with individuals who had a variety of different clinical issues, and I also worked with a few professional athletes because of those types of certifications. So the span in reality goes from anything on the sports performance side all the way to, like I said, preventative medicine and rehabilitation medicine.
I've also worked with a number of exercise science majors who decided to go to medical school.
Mm-hmm. Yeah, that's to that point. I think all the health science or all the graduate schools in health sciences are on the table as well.
And I will just add that biology major is becoming more flexible. We have redesigned our major recently, and what we have done is, first of all, students going into exercise science and biology would kind of start with the same set of courses. So if you discovered in your second year that you don't want to be an exercise science major, you could pretty readily transfer into the biology major. And secondly, we kind of have try to do something very intentionally, and I'm kind of referring to students. Someone here asked about minor. You major in biology, what about minor in biology? So in biology, we have tried to intentionally build elective courses in related disciplines in a way which would allow students to either come into the biology or get minors in those disciplines in which they may have started in, so that you don't feel like you have wasted your time in a certain area. So it's very common for our students to, for example, minor in chemistry. But we also, I think, after this recent revision of the curriculum, expect to see some more students attempting to maybe minor in exercise science or kind of get individualized minor in the areas that maybe have not been formalized yet. So we're really aware of students trying to do these things, and we try to work with the students to kind of accommodate that changing path. Another question we have is, and I'll ask Colin for you to answer this one, is about study abroad courses for science students.
Yeah, so one of the things that a lot of first-year students will ask is it even possible to study abroad as a science major? And the answer is categorically yes. There's a variety of different ways you can do it, but it's great that you're thinking about that and asking the question now, because one of the ways that you can make sure that it's possible is by doing a little advanced preparation. So the sort of three ways that I would say that it's easily possible for a student to study abroad, the simplest way is to just take a St. Thomas class that's offered off campus. So in the biology department alone, we have a bunch of courses which are typically offered every couple of years, where we have courses that go to Costa Rica or to the Bahamas or to Southern Africa or to New Zealand. And just that obviously is a UST course. Oftentimes those are in January, so there are short-term courses. The other option is to think of study abroad as a way to complement your science majors, right? Where there's a lot of things you can study very effectively in Minnesota, but something like marine biology or tropical ecology, it's not the best place to study. So you could go on a program that's focused very explicitly on that kind of experiential type of study. And we have a great international center at St. Thomas that works very closely with students to help them find, apply to, and participate in programs run by other schools or nonprofit type organizations. And the last way is to just sort of work with your advisor to carve out a semester in which you don't have to take any science classes, so that you can go to China or Spain or Ecuador or whatever, and just take courses that are relevant to the culture and whatever you're interested in there. And it is also possible to take science courses at universities in other countries, but it can make it a little bit easier if you've sort of made some space and don't have to do that. So the answer is absolutely you can study abroad.
And I will just add that we often also have students do individual research experience for credit elsewhere. So for example, I have active collaboration with a well-known German institution, Helmholtz Institute, and students going there, and they also go to University of Zagreb in Croatia, which is where I'm from, and so on. So in addition to the traditional classes, we also can design opportunities for students that are very individualized like that. And we typically rely on our personal research programs to provide those opportunities. We have a question that I will ask Paul to start addressing, and then Michael, if you have anything to add. And it is the question about major in nursing. And someone said that they have heard that something is coming up, but they weren't sure what's the status of that.
Yeah, so I can speak a little bit to that just because I was recently in a meeting with the Dean of the College of Health related to this. Nursing is still going to happen at St. Thomas. Whether or not that's an undergraduate major or a master's or a doctorate is still up for discussion. And that decision will be made by whoever comes in to become our official nursing director. And that search is underway, although has obviously been delayed by COVID-19. That's the furthest update I can give. So Michael, if you have more, please feel free to jump in.
No, Paul, thank you. That
did it.
good.
Right. Okay, Paul, one more question for you. This is a fun question.
Yes.
I think. How competitive is it for an exercise science major to be able to assist the trainer on a sports team?
To say competitive, if you're saying in terms of being able to secure a position with them, I would say that it's not overly competitive where you should be concerned with it if you're a good student who's interested in it. I think in the exercise science program, one of the things we're most proud of is our relationship with athletics and how that's really blossomed over the last 5 or 6 years. That's especially true because of our head athletic trainer, who's done a marvelous job of getting undergraduate exercise science students involved in the process of athletic training to a point where we have, I would say, at least half of our students who want to be in that program get in it pretty easily and are able to do things beyond just, you know, low level work. He has individuals working with athletic training out there, helping with diagnosing of injuries, even rehabbing. It's a lot more than just taping ankles. The second part of that I would just add on to is we're in the process of creating a similar program with our strength and conditioning staff, which leans more on the prehab side, so essentially prevention of injury. And those two programs work really well together. So I would say it'll become even less competitive as we move on, because as that strength and conditioning program blossoms, the two will sort of kind of form together.
I will take the next question, and maybe Martha, if you ever used any of these opportunities, I invite you to join me. So the question is, are there a lot of tutoring opportunities available for science classes? And just briefly to answer, yes, there are many. And I would just use biology department as an example. So we have tutors, but we also have something that's even better, in my opinion. We have these learning communities that are facilitated by peer students who have completed the course a year or two before. And what happens in these peer learning communities is that students kind of work collectively to solve the problems, and the exercises and the problems are provided to them by the faculty who teach courses. And my understanding is that math, chemistry, and biology have these kinds of activities associated with them. In addition to that, university also has various tutoring centers. Our students actually quite actively use math resources center and the writing center. I'm aware of that. And I don't know, Martha, is there anything that you have used as a student that maybe I'm forgetting?
I think a big one for me was using the Math Resource Center. That got me through my calculus course at St. Thomas for sure. And you know, the student there and the people there that are helping tutor you are just really knowledgeable on the content and always willing to help. And they have really great hours for students to come by. So I think that was just a really great resource. Also, professors have office hours and are always willing to, you know, meet with students one-on-one if you do have questions. And I found that to be really helpful throughout the experience as well.
We still have a little bit of time, so I'm sorry, I don't think we'll be able to answer all of the questions, but like I said before, we will make sure to address your questions in writing. So if you pose the question, it will be answered, but I would like to bring a couple more that are popping up quite frequently. And one of them is, what do science labs look online? And I think this is a relevant one given the situation. So let's hear from Colin. Why don't you tell us a little bit more about what the science lab might look like under ideal conditions, and maybe even under these non-ideal conditions in which we are now, where we had to transfer very quickly.
Yeah. So in the current semester, obviously, we all went into planning our labs as intentionally in-person classes. So we've had to sort of adjust on the fly a little bit. Some of the things that I can say that in our intro courses are doing a lot of, for example, one of the courses that I'm involved in is mostly taken by second semester students. That what they're doing is continuing with their sort of research question focused projects, but rather than actually conduct the research, they're given data sets to analyze. Then they're still continuing to sort of write presentations or sort of poster presentations for those. And that's another opportunity where they're having to work collaboratively. Some of the things that I've been doing in my upper level classes are having students research the topics a little bit more rather than sort of doing a wet bench type experiment. But to do a little bit more of a literature research or a little bit more of a sort of investigation of what the topic is and how it connects to some of the areas that they're interested in, particularly in healthcare, and have them turn it into more of a research type assignment rather than just a, follow these steps and analyze the data. That's my experience with it.
Thank you. I'm going to address the question about biology or global health major because we have several questions about it. And I guess the way I would answer this question is biology of global health major would be well poised to work on COVID-related problems. So basically the way that this major looks is you get the traditional classical hardcore science education with pretty strong emphasis on quantitative stuff. So for example, these students take additional statistics and biostatistics courses and epidemiology courses so that they know how to work with the big data sets and how to actually build those models that you all are hearing about. And typically they might take courses that actually specifically involve learning about how to model the spread of infectious disease and so on. However, at the same time, because global health major requires not just understanding of mechanisms of disease and drivers, math and things like that, we also try to explicitly address the public health side of things. So we're very interested in understanding how disease can be managed once it's contextualized in the society, in behaviors and beliefs that you all and I engage in. And also, we're very interested in educating these majors in interconnectedness of the environmental health and the infectious disease and coronavirus right now. I hate to say it, but to most of us who study in this field has not come as a surprise. It's something that was predicted, that was well understood. So I would say that biology global health major is a great major for individuals who are interested in integration across multiple disciplines and problem solving in context of societal and public health issues as well. And we still have a couple of minutes, so I will try to address very, very quickly, just a couple of the questions very generally. So there was a series of questions that were very specific, so I didn't pick to answer them today. But the gist of the questions was, if I took this course, how will it transfer? And if it transferred as such and such, what could I go into and so on? So I want to assure you that those questions will be addressed. We will answer them specifically. But I also want to tell you that there will be orientation and registration sessions for students during which you will have opportunity to interact with individual advisors, and some of those will be familiar faces. I think Tom Marsh, for example, will be one of those individuals, and we will help you kind of deal with those details specifically during that time and also before, if you would like to. If you have taken the courses which have transferred and you have gotten confirmation from the university that you have transferred, you can actually move on to what is next. And I think there were some specific questions about chemistry courses in particular. So Tom will make sure to address those later for you. We also had some questions about how accessible will be the introductory biology and chemistry courses, such as Chemistry 101 and Biology 207. And I can tell you that we always ensure that all students who want to be in those courses are accommodated, and we typically open additional sections of labs and lectures for those courses to make sure that we accommodate you. So you don't have to worry about not being able to enter those courses. There was also a series of questions about meeting the prerequisites to enter those courses. And the big message I have for you is that even if you have not tested into certain course right away, all of our majors are structured in such a way that you will have time in a first semester to catch up on those courses, and you will be able to join the courses in a second semester. And for all the pre-health majors, that is not going to put you behind. You can readily execute any of our majors in 3 to 3.5 years. And again, we will make sure during these individualized meetings to provide you with some ideas what to take and what not to take. And in addition to that, the chairs of a variety of departments right now are preparing orientation registration preparation, where we will kind of highlight some of the possible paths for those of you who have had those kinds of questions. And I think we are now out of time, but before we go, I just want to make sure to thank the audience who we couldn't see, and that was really odd for us not to see you, because when we teach these kinds of classes, we always see our students. So for me, this is the first time talking and not seeing the faces. So I hope the faces are happy. And I want to thank our panelists, and I'm actually going to let Martha close and tell us you know, those parting words about what made her experience here at St. Thomas worthwhile.
Yeah, thank you, Dalma. I guess one thing I really want to share with everyone is that when I think of my experience at St. Thomas, I think of the word community. I think more than anything, the people that I've come across through this experience made it all the more worthwhile. And I also think that just educationally, I was exposed to so many things that I just did not think I would get the opportunity to participate in, from research to studying abroad to joining all of these clubs and organizations and even having on-campus jobs. There are just so many opportunities and ways for students to get involved. And I hope you guys, we helped make this decision a little easier for you guys. I know you're all deciding on where you're going to be going here in the next couple of weeks, and hopefully it's St. Thomas. And I wish you all the best of luck. Yeah.
Thank you, Martha, and thank you, everyone. We have a few slides just giving you some additional information, and admissions is always available to answer those questions. And then again, if you have questions about financial aid, there are some prompts there as well. So thanks, everyone. Stay healthy, and we hope to see you in fall.